Hello everyone. Today's topic is super important one in healthcare economics, and that is pharmacoeconomic evaluation. It is used to assess the outcomes and the types of evaluations used to make smart treatment decisions. In this video, we'll see the overview of assessment types. The types will be discussed in the upcoming videos because the types has been asked in final exams as a separate question. So we'll see that in other video. Just here we'll see the overview. So starting with the introduction, pharmacoeconomic evaluation is a systemic method or assessment that compares what it compares cost of drug therapy, and with cost of drug therapy is compared with the clinical outcomes it produces. The outcome which is produced, it is compared with drug therapy cost. So it helps healthcare professionals to pick treatments that give the best value for money, cost effective decisions. Value for money, improving both patient care and resources use. So the outcome assessment of pharmacoeconomic evaluation. Let's see that when we evaluate treatments, we assess three types of outcomes. First one is clinical outcome, then we have humanistic outcomes, then the final one is economic outcomes. Let's see the clinical outcome. Focuses on patient health improvements. For example, lowering blood pressure in a hypertension patient. It also looks at drug efficacy, safety, and adverse effect, that is side effects. The second one is humanistic outcomes. It measures or evaluates how patients feel about the treatment, they are satisfied or not, and the quality of life is included in humanistic outcome. Tools like SF36 survey are used to assess healthcare related quality of life. Then we have economic outcome. So it evaluates the financial impact of treatment, includes direct cost, indirect cost, intangible cost. We have discussed in the previous video, direct cost means medication, hospital bills, etc. Then the indirect cost, loss of work. If someone is suffering from a disease, they will take a leave, or they will get fired from their jobs, so they lose their job. So it is also indirect cost. Intangible cost means pain, suffering, the patient is suffering from the disease, the pain, okay, that comes under the intangible cost. Let's go over the 5 major types of evaluations used in pharmacoeconomics. First one is CMA, cost minimization analysis. It is used when two treatments give the same outcome. Okay, listen carefully, that two treatments gives the same outcome but different in cost. Example, generic versus brand drugs. Comparing generic versus branded version of the same drug. So they give the same effectiveness, but the cost will be less of generic when compared to the brand drug. Moving on to the CEA, that is cost effectiveness analysis. What we'll do here? Here we compare cost per unit of clinical effect, clinical outcome or effect. Example, you will understand by the using of example. Cost per mmHg of blood pressure is reduced using two antihypertensive drugs. So here per unit, we are talking about the per unit, that is, if in our example we are reducing per mmHg blood pressure, we are reducing per mmHg by using comparing two antihypertensive drugs. Then we have cost benefit analysis. As the heading says, benefit analysis, it mainly focuses on quality and quantity of life. No, it mainly compares the health benefits. Okay, converts health outcomes into money, then compares to cost. So cost benefit analysis, it converts the health outcomes into money, then compares the cost. By seeing example you will understand that. Let's see that. Evaluating vaccination program by comparing total money saved to the cost of implementation. You understand that? Vaccination programs measuring financial savings versus cost of implementation. So when we are implementing this vaccination program, we are comparing that total money saved to the cost of implementation. Then we have CUA, that is cost utility analysis. It mainly focuses on quality and quantity of life gained. It uses indicators like QALY, DALY. Okay, two indicators are used. QALY means quality adjusted life years. DALY means disability adjusted life years. Example, a cancer therapy that adds two high quality life years. So when a cancer therapy is used, it added 2 life years to patient. If before using that cancer therapy, we thought that patient might be past patient that will happen in the upcoming 5 years, but after implementing that new therapy of cancer, he gained 2 life years, means he is living 7 years. So in CUA we measure that quality adjusted life years. And the final one is CCA, cost consequence analysis. In this, list of cost and outcomes separately, lists cost and outcomes separately without merging into one number. It is useful when different stakeholders like patient, hospitals or governments care about different priorities. So the pharmacoeconomic evaluations helps us make smart, cost-effective treatment decisions by measuring outcomes and comparing cost in multiple ways. So if you found this breakdown helpful, don't forget to like the video and share it with your pharmacy friends, and subscribe for more pharmacy knowledge content. See you in the next video.